Local leaders as well as state leaders have expressed concern over the lack of ICU beds as COVID-19 cases continue to rise. There have been talks for the state to step in and provide additional resources for rural healthcare facilities. Our Cash Matlock has that story.
It's everywhere. No, it's not just Jackson, it's everywhere.
State Health Officer Dr. Thomas Dobbs addressing questions about hospital overflow in Tuesday's Zoom press conference. He says the state has been in talks to provide additional resources to healthcare facilities, especially those in rural communities.
Healthcare is an exhaustible resource, and people are going to die because they will not have access to that resource. It's just inevitable.
Winston County EMA Director Buddy King says his county is doing well in some areas, but is strained in others.
Supplies are not the issue now. Initially they were, just because there were not warehouses full of personal protective equipment, yet the need was there.
King says at the beginning of the pandemic, it was hard to find an extra mask or even a pair of gloves.
We have no shortages right now, no palpable shortages. We can handle the increase and keep our health care workers protected as well as the general community protected.
He says the main issue is falling on hospitals without ICUs, like Winston Medical Center, a facility that typically transfers its ICU patients.
That hospital, which was never designed or staffed or equipped to be a critical care, takes on that role.
There have been rumors that the state could set up additional makeshift ICUs to ease the burden, but King says that's easier said than done.
I do believe that those factors are hard to replicate, especially to stand up to find critical care trained healthcare providers, to find the critical care necessary support equipment to treat the patient, as well as medication. There's so many. It's such a different level of health care that it's difficult to replicate or stand up.
He says right now our best hope is to continue to wear masks in public and socially distance.
The way to control the spread of this virus is people to limit their transportation, to limit their movement, to go back to that home-based involvement.
And King says Winston County has a reserve of medical supplies, and so far they haven't had to dip into any of that reserve.